This is the Skin Science Podcast. I'm Dr. Thomas Hitchcock, and here we'll investigate everything skin science and dissect it from a scientific perspective, analyze it from a medical perspective, critique it from a consumer perspective, and give insight from an industry perspective. Hello, everyone, and welcome to the Skin Science Podcast. I am Dr. Thomas Hitchcock, and with us in the studio is Angela Wilson McDonald. How are you, Angela?
I'm okay, Thomas. Fighting a nasty cold, but I'm going to make it through this.
Stay on your side, please.
I'm going to keep my distance. Don't worry. Don't worry.
All right. And we also have a special guest today, Dr. Jigna Patel. Dr. Patel, how are you?
I'm fine, thank you very much. How are you both?
Great. We are wonderful. And then we also have in the studio our producers, Seti and Alan. How are you guys doing back there?
Great. How are you?
Yeah.
I'm doing great. I'm actually doing fine. It's one of those things, this time of year is kind of a mixture of busy and tired and excited and sick and anxious and well, and because it's just all like everything's happening to wrap up the year and such.
Indeed.
So let me start this. Angela is going to introduce our guest for today, but before she does, you all know that science is a puzzle. And so I am a huge puzzle enthusiast, and I brought a couple puzzles today. This is one we'll talk about right now. This is called the Quest Tower. And this is actually really affordable. So if you have kids that like science and puzzles and stuff, this would be great. It's like $50, $60. Just Google Quest Tower puzzle. It's made of laser cut wood, and it uses a lot of brain power because you have to decipher symbols and how to open things. It's one of the reasons I love these types of puzzles, because it really is a mental exercise. And with the holobiont philosophy, which is about taking care of everything, part of that is your mind as well. You have to exercise your mind. So anyway, that's today's puzzle, and let's talk about our guest today.
Great, and that's a perfect lead into today's topic,
Yes.
I do believe, Thomas. So we are thrilled today to have Dr. Jigna Patel of Vedaskin. Vedaskin is located in the Essex area of London. Dr. Patel attained a bachelor's degree in human anatomy and cell biology in 2003, and thereafter went on to complete her Bachelor of Medicine and Bachelor of Surgery degree in 2008, with distinctions in medical science and special studies from the prestigious King's College London School of Medicine. Following her initial years rotating through various specialties, she landed herself in a career of pediatrics, where she obtained a diploma in child health with an intention to subspecialize in neonatal intensive care. A life-altering career move into general practice then ensued, and she qualified as a GP in 2015 and is a member of the Royal College of General Practitioners. In her medical practice, she naturally attracts and takes interest in the fields of dermatology, child, and mental health. It soon became apparent that the skill set, approach, and being known for meticulous attention to detail fueled her interest in aesthetics, skin health, and regenerative medicine. The last 3 years, she has been in a transition period to adopt and evolve the blended one approach, integrating holistic well-being, longevity supplementation, being a clinical lead advisor for Haneo technology, and connecting the dots between mind, body, and skin to heighten her skill base and presence from an industry educational perspective. She has collaborated with like-minded colleagues to educate at the UK's largest health optimization summit, Nutrition Collective, ACE, CCR, and written for the UK's leading aesthetics journals and Aesthetic Medicine magazine, and is on course to take her knowledge across the world. And she's bringing that knowledge to us here today, Thomas.
Wonderful. And it was our pleasure to host Dr. Patel when she visited Dallas not a few weeks ago. So it was great to have you visiting us locally. And we saw her not too much before that in London when we launched. What were we launching there?
Biojuve? In September.
In September, yeah.
Mm-hmm.
Yeah, just that small thing,
Just a little thing we were doing
that we're now talking about all the time.
Yeah, well, I just sometimes the days and stuff run into each other after a while. Anyhow, today we're going to be talking about something that is very interesting. We've touched on it in some other places before, but we want to talk about some of the habits that we need to unlearn, and not just habits, but the knowledge that we need to unlearn that we've been taught, and why. And that's one of the things that I find a lot of resistance, talking about BioJuve, I find resistance with it as well. But in general, I find a pretty strong resistance to people being almost like they're offended if something that they have been taught is now incorrect. It's almost a religious type of thing where they're like, don't question my faith, my knowledge. And I think it's really, as a scientist or a clinician, is something that we need to get past, because of the same thing that I say all the time that Dr. Doris Day used to say to me, which is, we can only do as good with what we know, the knowledge base we know, but when we know better, it's on us to do better. And so that's really where I think there's a lot of things that are changing right now, because there are certain infrastructures that make a ton of money that have to change to move science forward. And it's going to take some really vocal people to get those things moving forward, some truth bombs and such. So, Dr. Patel, how would you like to preface this conversation?
So I think it's like you said, right? Sometimes it's uncomfortable when we are put in a place where we're meant to question what we've been taught. And a lot of us in clinical practice, you go through sets of hoops, you tick boxes, you pass exams, and you don't necessarily question what you're being taught because you don't have the life experience or the clinical experience to do so.
That's right.
But I came across a quote, which I put up today on Instagram. We're drowning in information, but we're starved for knowledge and understanding. So, companies, conferences, lectures, you can sit there and be inundated with amazing facts. But if you take it one step further, I'm one of those people that wants to know how, what, why, where, when. And that's a problem for some people, because that's where you can see that the knowledge is maybe not quite up to scratch, or the understanding or reasoning starts to, dwindle. So as opposed to making this negative, I think it's exciting to be able to know that there is so much more to know, and that we can work with what we've got, but there are some concepts and some basic actually understanding which we might need to revisit and remodel. And I was thinking about this, I know we'll go into it, but even coming down to what people understand by the function of a hair follicle. And I went back and reflected on, some basic teaching when I came into aesthetics about 7 years ago. And I'm just thinking, gosh, we're missing the connections. It's almost like we're not realizing that the body is more than just the skin, and the skin is connected in so many ways. So I think what the problem also is that social media, as I know you've touched on this before, and we're so aware of it. We are just getting bombarded with varying quality of opinions, varying quality of knowledge, and for a consumer, it's really difficult for a consumer more so than us. It's really difficult for them to know what's the right thing to do. So that's when all the trying and all of the experimenting and all of that person looks great because they're doing that. There's a disconnect between people realizing that we're not all the same being and the same person and from the same background.
Right.
So it can be positive. We don't have to be negative. I find it really exciting. I like to be challenged.
Yeah.
I think sometimes you need it to grow
of course,
and progress.
Of course. Yeah. The thing is, that definitely doesn't have to be negative. It's unfortunate that people take it in a negative way. And like you said, I'm the type of person that's always asked the question why. And, as a child, people did not like that. It's more, and the answer that was given a lot of times that really just kind of made me fume was because I said so. And I found that to be the most unappealing answer ever, because at the end of the day, if you don't understand why, it's hard for you to buy into something. I mean, I get that, there's certain things that you just accept when you're a child because, you may not understand why pulling that pot of boiling water off of the stove might hurt you. But once you get to a certain age, if you ask the question why to somebody who should know the answer to that, they should be willing to at least give you some cursory answer or direct you to a place to look for the answer. Otherwise, you're kind of left at being stagnant as a society if we don't ask the questions of why. And a lot of times the answer to the question why can change over time based on the information that we have. So, what I say to people is it's not that all the science that was done in the last 60 years was incorrect. It's not that the data is useless. It's that the conclusions made based on that data may need to be adjusted by looking at it through a different lens because we know more information now. And so there's, for instance, one of the things that people often, when we're talking about the skin microbiome is basically that, for instance, with atopic dermatitis, they say, well, Staph aureus is one of the major culprits for driving the emergence of atopic dermatitis lesions on the skin. And my answer to that is that may be true that it's present, but what about what's not present? What about what's absent in those lesions? And what about the fact that when you bring that into the equation, it's less of a infection, it's more of an imbalance. And that changes the way that we look to treat. Because rather than try to sterilize a lesion, or maybe look to introduce something to it. And that's really where I think this all comes into play, is because especially with the skin microbiome, which is where BioJuve plays and we talked about earlier, that's one of the things that we need to rethink is, are we doing things with the knowledge that we have in the way that we should, given what we know now? So
I like to, and we've had a big hurdle over the last year introducing the first living skin biome care line to the market worldwide. And I do find that people struggle in particular with the knowledge that they've been operating under for really the last 20 to 30 years. It's been a lot of the same. Mm-hmm. And I find that just reminding people that science is always progressing, and that is true for skin science as well. And we're at this point now, we're in the midst of a paradigm shift that we're finding that there's better ways to treat the skin. And once I think you kind of challenge them to realize that the science is always progression, I do find them quite open to listening. But you're right, Thomas, you do have to provide the why. They're not going to just take your word for it. They want to understand intimately why you're making the statements that you are, that what you have is a better way of treating the skin than what they've previously done.
100%. And so I'll tell you, Dr. Patel, I don't know how you were taught in school, but one of the challenges that I face is that I want to educate our young folk at the lower levels about some of the realities that we're finding. I actually just spoke to my nephew who's in 6th grade in his class. I spoke to them when I was in Tampa for business on germs and how not all germs are bad. And it turned into, which was really weird, that it turned into money. They started asking me how much I make. I was like, what is wrong with these kids? I'm like, is there any science questions?
They want to know if they should go into germs.
I don't know. But regardless, I wanted to teach them because even at the medical school level, when I've been asked to teach a skin biology course, I said, sure, but I want to teach it in the way that I want to teach it, which is that it's a holobiont. Its skin is composed of not just the human parts, but the microbial parts as well. And they all are interacting in order to have truly to have symbiosis and skin health. And they said, no, you can't do that. And I was like, why? This is when they should be learning. They said, because it's not on the boards. And all we're doing is trying to get them to pass the boards so they can go practice medicine. And my thought is, well, that's kind of silly. Don't you want them to enter medicine with the most scientifically forward information? Because then they don't have to learn while they're treating. They can actually learn before they're treating in the best ways to treat. And so during residency, if physicians already don't have this information, how are they going to teach other physicians? So when in the chain of gaining knowledge, do you get the new information? What is your thoughts, Dr. Patel?
Yeah, I think you're right there. And I'm just conscious I spend some of my life in general practice. So we see a lot of skin as a subspecialty. And I, just when you were saying about med school, we're also subject taught, right? So we're taught, here's skin, and then that's all you do. And here's heart, here's this. And I'm really struggling to think, when did we ever sit down and connect the dots? We
That's right.
didn't.
That's right.
And then you rotate through specialties. And I think unless you're doing something like intensive care of some format or public health, which a lot of people don't do, you're subject driven. So making the connections is really hard unless you stumble across practitioners and people who think like a whole being. And that's some of the restrictions of practicing in medicine, right? There's some amazing parts to it as well, but to gain knowledge, you have to step outside of your rigorous way of training. And sometimes that involves talking to people outside of your field. And that's a really alien thing for some people. I think it's because they're not comfortable. And as clinicians and as practitioners, we're moving into this era now where we have to think about a whole being and have to understand that what you see on the surface means a whole bunch of stuff internally and vice versa. And it doesn't fly anymore just to kind of have a one-directional approach. So where do you learn that? You have to think, well, I'm going to go and learn from a nutritionist or a functional medic or a scientist and make the time. And sometimes you have to take a risk and, step back from practice to do that. But then you realize actually it makes life a lot easier when you're practicing because you can see what's going on and undo things and redo them. And you end up with better patient or consumer satisfaction because you're helping them learn more about themselves and learn how to care for their biomes or surfaces in a better way than just kind of use these 5 products or 6 products and that's it, and you get that glow or whatever it is that you're trying to achieve. But people want more. So we have to know more or do better. And that's my take on that.
Yeah, well, I don't know if you have any thoughts on that.
You may give your thoughts. What I wanted to do for each of you is just, I know you will. I know you will. Is to boil it down to, you mentioned, I always like to know the why. So what I'd like to hear from each of you is for the providers, for the clinicians who are listening, why do they need to unlearn some of what they've been taught over the time that they've had between medical school, but training to practice? And then for the consumers, why is it important for them to unlearn? What's in it for them? What would you say as a practicing clinician, Dr. Patel, is the why that it's important to unlearn?
Or to evaluate before you unlearn?
Well, I think I think we have to understand what it is that we're trying to achieve. So if we have this medicine, I'll just give you an example of throwing medications or throwing topicals or throwing creams at people. Is that helping someone get better? Is it making things worse, perhaps? Is the biome on the surface, if we're going to give that as an example, receptive to what you're doing? And is what you're putting on going to be effective if other things are there on the surface that might influence how effective that is? So that's one aspect. And then I think I'm just going to pick this, I'm going to come back to the hair follicle and talk about that. We've been taught this very sort of rigid, blocked pores, excess sebum, proliferation of C. acnes, and kill it. It's bad, it's bad, it's bad. And I will say that's what happened when I was training all the way up until about 2017. And I thought, is it really? Because some people I know haven't done anything and they've got better. So I then started switching the way I used to think. It's like, do I need to actually do all of what's in guidance? What if I step back? What will happen? What could go wrong? And I now practice like that, which is a little bit alien because people think GP or clinician, you're just going to chuck everything at me. But I'm like, no. Let's step back a little bit. And sometimes we have to think about other aspects that might help you improve. And I know that's for the next podcast. But when you then go, but is it that? But why is it not getting worse? Then I think, okay, do we need to, or have we got a need to understand what actually this hair follicle does and what's meant to be there and what happens when you take it away? And I think because of the way treatments, for example, have evolved, and I know I raised this before, it's like if we destroy something on the skin surface, is that good? Is that not going to cause a problem and an imbalance in something? And But yes, that makes sense because we weren't born without certain things. So why would you want to take them away? I try and simplify it down a little bit. And I think by doing that, it just sets the wheels in motion for others to go, you know what, maybe you're right. Maybe we won't try this and we'll make less is better or less is more as the approach. So I try and unpick that way and then rebuild. I kind of have that strategy for whether it's in medicine or in aesthetics.
Yeah, I agree with you. When it comes down to it, like when I remember when I was doing my postdoctorate, I had this idea of how to, do gene sequencing for a single strand of nucleic acid, and I had a rationale for it and everything. But regardless, my PI said to me, Thomas, you don't have to reinvent everything. Sometimes you just want to take the work that people have done and just trust that it's correct. And that sentiment I get. I understand. You can't redo everything every time. Otherwise, you'll never make any progress. But there are certain times that you need people in the world that actually look at things and deconstruct them and say, why do we do it this way? Because the information that I've learned tells me we should do it another way, or there's a better way. That's how innovation happens. That's how inventions are made. That's how, discoveries are made, because people ask the questions. If we said, definitively, we know, since was the example that you just brought up, acne. If we know what causes acne and how to cure acne, then why should we do any more research for acne? We just throw our hands up and say some people are going to have it and we can't do anything about it. Or we can say maybe we're learning more information that it has more to do with certain things than we thought and less to do with certain things than we thought, and adjust the way that we do things in order to match what we learned or we know now. It doesn't mean that what we did in the past was wrong. It was correct based on the knowledge that we thought we had. But that's the part that, for me, that's the why that people need to reevaluate and unlearn, because clinicians are busy. They're seeing many patients every day. A lot of them don't have time to sit down and read all of the new research in science and medicine, and be completely on the cutting edge. But that's where I think, in my opinion, some of the conferences go a little bit awry, because I hear a lot of the same old stuff rehashed time after time after time. And if I'm hearing this, and I don't go to all these conferences, I go to a number of them, but think about the attendees. They're hearing the same things over, and they're all coming wanting to hear the newest, but they're not hearing the newest and that's where I think the industry probably could do a better job with getting people like scientists involved versus just clinicians, because we can all learn from each other. It's a give and a take. And like Dr. Patel was saying, it's not just our disciplines either. It's learning from other disciplines. So for instance, we're doing work with bioinformatics, and that's not my forte as a geneticist, but it's definitely something that's going to give us a huge amount of information. And so we're having to, find people that can do this for us. But at the end of the day, when we all admit we don't know everything, and that there's some things we're experts in and other things we're complete naive in, that is going to help us to move everything forward, because we can find the people that are the experts in the stuff that we're naive in and help us to actually connect the dots. Because I agree, it's all connected, and that's my whole philosophy that I've developed over the last 10 years. And it's very similar to Dr. Patel. That's why we felt that she should be on the podcast, because it's not that skin is this separate organ that runs independently of everything else. It's extremely connected to everything, and not just physically. Although there's connective tissue that connects it to muscle, fat, bone, all that stuff. It's also through the immune system. It's the body's largest immune organ. And since this is the Skin Science podcast, we'll kind of focus on skin. But at the end of the day, that's where I think there's a little bit of disconnect. Is people think I can just put a topical on my skin and call it a day. I've actually been asked when I lecture about BioJuve, somebody once asked me, or a couple people have asked me this: how long do I have to use BioJuve? And my answer is, well, why did you start using BioJuve in the first place? If you had an imbalance, and that's why you're using it, have you changed everything that caused the imbalance? Because if you haven't, that's like saying, how long do I have to diet before I can go back to eating all junk food? you're going to get healthy, and then eventually you're just going to get
Precisely.
unhealthy again. And so if you don't change anything, then nothing's going to change. If that's not too redundant. Your thoughts, Dr. Patel or Angela?
Yeah. I'm conscious that I know we're going to go into that more when we do gut, brain, skin, but I think attitude, consumer attitude as well, actually, right? So you see what people get sucked in by, and it's amazing what people get sucked in by, but there's some sort of instant catch, and I feel like we're linking podcasts together, but this acute dopamine spike fix that comes out of seeing something and getting a reward from doing what that person's doing. But is that really going to be right for you? So, when we think about unlearning, we also have to think about individualizing care. No two people are the same. You might have the same condition, but what perpetuates your condition might be for a whole bunch of other reasons, whether it's genetics, your lifestyle, lack of, all of that. But I think if we can step back a little bit and just see, are we really achieving what we want to achieve? And if I don't know something, is there harm in learning about it? No, of course not. It might change the way you practice. It certainly changes the way I practice. And I think it's good to share that with patients. I have conversations every week with patients where I'm like, so what do you think we should do? And they just find it mind-boggling. And I was like, no, seriously, because I'm not you. And this might not work for you. And I've been in several situations where the patients have proven me wrong. And I'm like, great, well, I've learned from you. And then maybe I can apply that principle to the next person. And that's how we progress. That's how we move forward with anything, and with science especially. It's like you're always trying theories and hypotheses, and some things work out and some things don't. Medicine is a little different sometimes. You can't always be forgiving with testing, right? But we're not frequently I think we're more frequently in a situation where we can take a step back to go, is there another way we can do this that might be as effective, safer maybe, or require a different approach?
Yeah, and it's interesting because one of the things that differ between what I do and what you do is I oversee a clinic, but we do clinical studies which are very much controlled. So we control the environment, we control the regimen, we control what comorbidities the people have. In what you do, it's a real world, meaning you can't control all of these things. So what works in a clinical study may not work in the real world for every single person because everybody has different situations. That being said, you and other clinicians have a unique opportunity to gather that real world information and use that to the benefit of science and medicine. That's why I always am loving when people put case studies and stuff into the literature, because it starts to pose a question. Like, for instance, there was a case study, now I'm drawing a blank. I think it was in the 90s. And it was basically this physician that described that he had 3 individual people that were not related at all, 2 males and a female, and they all presented with acne, both on the face and the body. And he was not treating them necessarily for the acne, he was treating them for some other condition, I can't remember what, but they all took oral antifungals, and each of them cleared up their acne. It completely cleared up their acne. And then when they got off the antifungals, the acne came back. And so that, to me, is something where we know that body acne tends to have more of a fungal component, but the fact of the matter is we're finding out more and more that the face also has a huge fungal component to it, even though it's not in a damp area necessarily. There are lipophilic fungus, like in the genus Malassezia, that actually really enjoy anywhere that there's sebaceous secretions. And that being said, initially what people might say is, well, then let's use antifungals and kill everything. No, that's not necessarily the point. The point is that we have to find a balance. And when we start to understand all the components of the skin microflora and the skin itself, we start to understand that these things have their places. So, for instance, staph epidermidis is thought to be a skin commensal. However, it produces this protease that actually helps for desquamation of skin. So it helps us to break the little chains that hold the dead skin cells or the corneocytes, and it allows them to slough off. So we need that protease activity in order to clear off the old dead cells in an efficient manner. However, what people are now finding out is that when you raise the pH of skin, that protease activity can become way too aggressive. And you could end up with way too much barrier relief, and that ends up leading to things like atopic dermatitis, because not only does higher pH allow for more staph growth, it reduces the amount of C. acnes growth, and C. acnes actually lowers pH of skin. It actually helps to modulate that protease activity. And so by killing sebaceous glands, what you're doing is you're killing things like malassezia, yes, because they don't have as much food source, but you're also killing off the C. acnes, which is another lipophile, and then you have more Staph aureus, which is going to end up, and Staph epidermidis, which can raise the pH, cause things like atopic dermatitis. And if you get rid of those glands, they're not, a lot of times they won't come back. And hopefully we'll find out that they do, because I've heard some people say that the laser-based systems, they eventually grow back. We'll see. But
okay.
Yeah.
So Bob?
Yeah, well, before, I was going to say, like, I know I was at a conference earlier on this year in March, and I feel like I was the only one who sat there completely stunned. I was like, is anyone else not seeing that this sounds like counterintuitive to just blast and destroy all of the sebaceous glands? Like, I'm missing something here.
No, you're not the only one. Unfortunately, people aren't vocal, though.
Yeah, and then I thought, should I be? And then I thought, no, you know what? Just listen.
I think you're right.
Work out like why this might not be clever. But it'd be interesting to see how those patients have been since. I think there's been some 12-month mark data that's come out, but I wonder whether they're going to report whether these patients have struggled with, skin infections, and whether they've struggled with barrier compromise. Whether they'll even report those findings, we don't know. But it's nice to be able to think, is this the right thing to do? Because that prompts you to then go away and learn. And like you were saying before about the immune system, when I was referencing like traditional methods, and we'd see this page of the skin layer with the hair follicle, and then these arrows coming out saying the causes of acne. The missing bit in there is about bioimbalance and where the immune cells sit. Those two core bits have been missing the whole time.
Absolutely.
And it can be simplified down and put into a new diagram. I might even make a new diagram just to kind of update knowledge and say, you know what, it's not just sitting here on the surface by itself. What it's doing is also communicating with underneath, and what you're doing internally is communicating up with the surface, and taking stuff away might not be so bright, but adding stuff back in might be clever.
Right.
And here is why.
Yeah. And
it might just need simple things like that,
Yeah. And there's a whole, the thing is, you said make it simple, but the fact is biology just isn't simple. And,
no,
there are some simple kind of, overviews that you can say certain things, but the more that I learn, the more that I know that I know very little when it comes to biological processes and genetics and such, because there's just so much, and it's all intricately balanced together. That means that we really have to use, until we have these supercomputers that can actually model these things, and I think we're not getting too far away. It's really just requires people to actually ask the questions of how things are connected, because really that's where we're going to move things forward when it comes. So for instance, let's look at, here we got understanding skin cells and their behaviors, the life cycle of skin cells, skin cell turnover, more actives, more skin layers, destroying hair follicles, sebaceous glands. We just talked about that. The role of DNA damage and repair in skin health. Okay, so let's talk about that a little bit, about what we need to unlearn and learn. So do you have any thoughts, or should I start?
Well, this is, I guess it moves us into this realm of getting to the root cause of what is happening internally, right, at a cellular level. So I think people are well versed and can associate, even as consumers, that, external factors, UV damage, smoking, not taking care of your health can have, deleterious effects for your body in general. But what's going on down at this teeny tiny level, and that whole world is exploding. And I spend a little bit of time in longevity, and if we start to understand, there's something called hallmarks of aging, which sounds really depressing, but there's several factors involved there which us to make sense of the why. Why do we age? Why might we be recovering slower? Why might sun damage take longer or, might be harder to treat? So when we start looking at these factors, and that's often involving things like mitochondria, looking at telomeres and looking at stem cells and their ability to get exhausted, we can start to then work out, right, okay, if a cell is damaged, it might then release chemicals or cytokines or signals that are pro-inflammatory, and then that has a knock-on effect on something else, and then that makes your antioxidants deplete or get overwhelmed, and then we swing into this direction of something called oxidative stress, and then that has other effects. So it's this kind of not self-perpetuating, but things are all interconnected even at a really tiny microscopic level. And we are starting to think more about the habits that we have and what we do or maybe not do at that deep level. And if we're moving in that direction, it's helpful to kind of just have an idea of what that means. And so that's why I've kind of moved into that direction, because a lot of what that involves is actually not putting stuff on the skin, that it might be via supplementation or living a certain lifestyle that might cause us to release certain factors and chemicals for the positive. And not everything is medicated. So that's where I think, if we can start to understand that why, it then makes what you do on the surface feel a little bit more rewarding, I suppose, or how we might eat then becomes a little bit more logical to understand. Even the basic guidance that people get, like you eat better, but what does that mean? But why?
Right.
It all comes down to those simple but whys, I think.
Yeah, so that's a good point about people just saying you need to eat better, because there's a lot of people that'll go and they'll think because they get something with lettuce and call it a salad that that's a healthy diet, when the dressing itself is just as fatty and sugary as a lot of the stuff that they could eat. And now, is it a step in the right direction? Probably, but when it comes to, you're absolutely correct when it comes to looking at the connectedness or the interconnectivity of things, even on the microscopic level, even on the cellular level. I did my doctorate in DNA damage and repair, actually. And what I was looking at was there's actually a molecule that is absolutely required for life called nitric oxide, but it is a potent mutagen. And it can actually cause pretty significant amounts of DNA damage that I don't know how, I didn't continue, but my theory was my next kind of, train of thought was that this particular damage would actually cause to where the body would not know what to put there, because a lot of times with DNA damage, you have an opposite side that you can match with or whatever. And so regardless, this particular type of damage was unique in the sense that it was potentially more carcinogenic than other types of DNA damage. And the reason why I'm bringing that up is because when we think about how things are connected, there's a lot of people that in the supplement industry that think that more equals better. If somebody discovers a molecule, flood the body with that molecule. If you flood the body with nitric oxide, that's not a great thing to do. It may dilate your blood vessels. You might have a acute sense of euphoria or feel better. But the thing is, you have to think about, where's the excess going? And what is the excess doing? How is the body clearing that? It's a reactive molecule. It's the same thing with antioxidants. We have people like David Sinclair comes out with a study on resveratrol, and all of a sudden people are going out and buying resveratrol and trying to eat as much. And I'm not saying that David was wrong to publish his studies in mice, but mice are not people. And on top of that, there is such a thing as reductive damage, which is the opposite of oxidative damage. Yes. So you can overdo it by taking a flood of antioxidants willy-nilly. And that's where I think we need to kind of step back and reevaluate. It's not that we are using the wrong molecules. It's not that we have the wrong intention. It's that we need to keep in mind that their balance just keeps coming back up, because that's really what medicine, in my opinion, should be about, is a balance. Because our bodies are genetically made. We have certain organisms that are inherent to our bodies. And when they're in balance, we seem to be healthy. It's when we start to lose that balance. So when we start to age, we start to lose the balance of senescent cells to non-senescent cells. Our T cells start to become more Treg cells, so they tell the body not to attack those senescent cells or get rid of them, or cancer cells even. That's why as we age, we progressively have higher amounts of incidences of cancers. And so these are the things where I think if we can get more to a place of what is the proper balance, understanding why we take certain things for certain reasons. An example of this is you mentioned mitochondria. And so NAD is very important in cellular respiration, and we do know that it tends to be reduced as we age as far as the amount that our mitochondria produce. Is there an issue?
No, go ahead.
Okay. And so basically, one of the things though, that most people don't realize is that, because there's a really big thing of NMN, which is a precursor to NAD in synthesis. But what people don't realize is that there's really a cycle in which these molecules are made, used, and remade. And, when you mess with the cycle in certain places, there's negative feedback loops and positive ones. So you can actually cause your body to stop producing NAD because you're over supplementing in a certain part of the life cycle. This happens with men who take testosterone replacement. When you put that into your body says, I have too much testosterone, and it causes your testicles to stop producing. And again, you can get atrophy of the testicles, and that can actually lead to cancers. And so these are the things that we need to realize, is that more is not always better. Balance is better. And that's my opinion, of course. But that's where I think the science is leading us, is that we have to do things thoughtfully and intentionally versus just because it's the standard of care all the time.
So I think what we've heard so far is the importance of unlearning, that science is always progressing, but that science is only as good as a clinician's willingness to be open-minded to what is new and to educate them on themselves on what is new, and ask the hard questions like, why should I be making the decisions that I need to make? Yes,
but I'm thinking we might want to change the word from unlearning to re-evaluating or reinterpreting, or
questioning. Maybe questioning.
Well, always questioning. We should always be questioning.
Curious.
Yes, we should always do that. But the thing is, I think it's less about unlearning. It's more about reevaluating and reinterpreting.
Evolving. Evolving is a good word. Okay, so Dr. Patel, you've done this. We just listened to your bio. You are somebody who obviously by nature is probably very inquisitive, always pushing the status quo. So a clinician is listening right now and they're saying, I want to be that person. I'm box checking every day. I'm just doing what I was taught, and I'm doing it really well, and I've built a successful practice, and I've got very happy patients, but I know I could do better. I know I could do more. What advice would you give a clinician on how to move into that more evolution of medicine? And then also speak to, what advice would you give patients? Because patients have to advocate for themselves. So they walk in the door to meet with the clinician. What advice do you give the consumer on making sure they're connected to someone who's staying on the forefront of science?
Yeah, so first of all, listen to this podcast, right? So that's a good place to start. But I think for clinicians who are listening, for instance, if you're in the skin and aesthetic industry, is, stepping away, maybe go to something new. I delved in and looked at the biohacking side. It was overwhelming and stunning at the types of people that you meet, but you learn from these people. In a sense, you learn for their reasons to not necessarily believe what you would normally say. So then sit in and have a listen at how they might deal with their health, how they might deal with sleep and stress and acne and eczema. And it's amazing, because that's how you start to learn about all these other little things that might actually have relevance. So finding resources, there are lots of practitioners out there who put out information in terms of webinars and podcasts, etc., that you just have to sit down and think, which area might I want to develop and progress in? Yes, I might have happy patients, but is there an area or a case that might inspire me to go away and rethink how I've practiced? And then for consumers, Well, this is a tough one because we can't control that. But having them question not so much credentials, but where they're getting their knowledge from. So if I've been away and learned from someone abroad, or I've been on a course that's completely new to me, I'll share it with patients and say, you know what, 3 months ago we were talking about trying this, but actually I think that's not the right way. Maybe we should think about this option, and here's why. So they're more likely then to trust you. A great example is probably the fact that you have brought in this new skin biome care, and that's a great way to practice getting the message across, because it's a little bit unexpected, but actually when you put the interest and show, you know what, actually we now know that this is good and this can do things that your topicals can also do, but maybe we can use what we normally have in our own biome and support and nourish our skin barriers. That it's just kind of giving something that's been working for me, fingers crossed. But actually it's nice then because patients then come back and say, you know what, I actually really like this idea. I like the less is more. I like that we're not as stepwise as before and it was too much, and but actually this is simpler, and you know what, it's working. I'm not going to question it. But sometimes when you get carried away with things, you have to think, is it right for everyone, and can I step back a little bit and think, who is this best for, and who do I need to sit down and educate more before we introduce the topic? So that's kind of how I see navigating consumers.
Yeah, I agree. One of the reasons why when we developed BioJuve, we wanted to sell through physician dispense channels was because we felt that going direct to consumers, it'd be just way too overwhelming for them they don't even understand skin biology, a lot of them already. But so we felt that we needed to convince the physicians and the clinicians of the new science and the way that things are going. And then they'll eventually cascade that down to their patients, who eventually will cascade that to each other. And it will become, part of the, I guess the word is zeitgeist, but until, the thing is, that's what happens with a lot of innovations. It takes a little bit of time for it to really change things. And it's all because people have a hard time not unlearning necessarily, but reevaluating, reinterpreting. And I think until somebody's given a good reason to reinterpret, why should we expect them to? And so I think that's what this podcast and other ones like this are meant to do, is to get people thinking, should I be reinterpreting? Should I be reevaluating? And I hope that everybody takes the opportunity to do that, especially when it comes to skin health and how integrated it is to the rest of our health. And so we're out of time for now. Any last thoughts, Dr. Patel?
Just know that in order to progress, we need to think beyond what perhaps we're always doing. And there's so many avenues and options out there to explore, and it's just about finding what sits well with you in your practice. And then for consumers to kind of try and find one or two resources that they trust and has a consistent message as well, and isn't darting all over the place. That's a good place to start, to sift through all of the chaos that's out there. And I think, it will take time, but it's a really exciting step. I think it's got merit to it. So I'm pretty happy.
Yeah, wonderful. And Angela, any last thoughts?
No, I think it's just what we've already talked about, is that from a clinician standpoint, just consistently challenging yourself to bring the science all the way down to the patient level. And what I heard from you, Dr. Patel, is also being humble enough to step back and go, I know this is what I recommended to you 3 months ago. And 3 months ago, I thought this was the very best option for you. But you know what? Here's what I've learned since then. Mm-hmm. And because of that, I feel this is a better choice. Do you want to go on this journey with me as we discover really what is the optimal way we treat your health, including your skin health? And, sometimes I feel like it's not about the desire to do that. I think people generally, especially in the healthcare field, generally want to do well. It's about taking the time and stepping back for a moment just to sit and learn and be. And I love what you said about attending, tapping into resources you haven't always tapped into. And it reminded me of the quote that, if you're always doing the same thing and expecting a different outcome, you'll never have and a different outcome. You've got to challenge yourself to do things that are different if you want to be different and if you want to create a different outcome.
Wonderful. Lots of food for thought. So, Dr. Patel, if people wanted to learn more about you or find you, is there any place in particular you'd like to direct them?
Yes, I'm an Instagrammer. So you can find me at Vedaskin Clinic, and you can reach out to me. I will respond to DMs if they're appropriate. But yes, I'm predominantly Instagram. That's me. I want to spend the rest of my time taking care of me. So that's where you'll find me.
All right, wonderful. And Angela, where would they find you?
Well, you always kind of chuckle when you say that, Thomas. I'm also on Instagram at Angela Wilson McDonald, and also at Crown Aesthetics at amcdonald@crownaesthetics.com.
Okay, and I am, you can follow me at dr.t.hitchcock, that's dr.t.hitchcock on Instagram. And that's really the only place. I don't really have much other social media other than occasionally on LinkedIn. But you could also go to the Crown Laboratories website and follow all of our socials there for BioJu, for SkinPen, for Crown Laboratories, for Crown Aesthetics, whichever one you're the most interested in. Anyhow, thank you so much for your eyes and your ears. We hope you gleaned something from this discussion. And until next time, we'll see you later. Goodbye for now.